Hi, I'm Dr. Krista Jordan. I'm a clinical psychologist in Austin, Texas with a private practice. And I wanted to talk today about becoming an educated consumer for the ADHD evaluation. You might be considering getting an ADHD evaluation for your child. Sometimes the school has recommended this, or you may just have noticed as a parent that you think your kid has some of these symptoms. Or you could be an adult who either was diagnosed in childhood but never fully treated, or maybe was never diagnosed in childhood, but maybe you've always kind of had a sneaking suspicion that you might have ADHD. So if you think you or your child might have ADHD, what would you want to know about evaluations? I'd like to make a very important distinction. ADHD evaluations can be very expensive and very time intensive, requiring 8 or more hours of neuropsychological testing. Now, is that necessary in every case? No. Here's the difference. If you want to access provisions under the Americans with Disabilities Act, because ADHD is a neurodevelopmental disability, and by law, people with ADHD, children and adults, have certain protections under the law that allow them to access things like extra time to complete work, or a distraction-free work environment, or extra reminders from the teacher. So these types of accommodations are covered under what's called Public Law 504. And so if you are wanting to access legal accommodations and get this declared as a legal status, you will need to undergo a full neuropsychological evaluation. That is something that is only done by a neuropsychologist, and they should have experience in working with ADHD. Now, why does it take so long? Because to do a really full, thorough evaluation to qualify you for disabilities, we have to make sure that there aren't any other issues in the mix that might also be causing similar symptoms. So in a previous video, I discussed some of the symptoms of ADHD. And let's say, for example, the memory piece, that people with ADHD often may have some problems in what's called working memory. Well, people with depression and also anxiety can have trouble with working memory simply based on the anxiety or the depression. And so you wouldn't want to diagnose someone with ADHD because they have problems in working memory if in fact what's really going on is that they're in the middle of a major depressive episode, and as soon as that major depressive episode clears, their working memory goes back to normal. They don't have ADHD, they had a working memory deficit that was part of a depression. So in a full neuropsych evaluation, they are going to administer an IQ test, academic testing, mood disorder testing, and basically be looking at anything else that could be interfering with the person's cognitive functioning. They're going to rule out learning disabilities, mood disorders, brain injuries, exposure to neurotoxins, all kinds of things to make sure that, in fact, it is ADHD before you get that seal of being declared disabled in a legal sense that can be used to access these accommodations that are your right as a person with a formal disability. So it is true, you will need to go through a real lengthy and probably expensive evaluation if you're wanting to do that. Now, what if you're an adult and so you're out of college, you're not needing any kind of legal accommodations, you don't need to, for example, go take your midterm exam in a separate room where it's quiet, because you don't take midterm examinations anymore, thank goodness. But let's say that you feel like you are having some trouble at work and in your home life, and you're suspecting that maybe you have ADHD. So I guess the first question would be, should I bother to get evaluated? My answer would be yes, because there are many treatments for ADHD. Some are medication, some are non-medication, and even within the class of medication, we have stimulants and we have non-stimulant based medications. So there's actually a lot we can do to help support a person with ADHD so that they can function better. But we're not going to employ any of those treatments if we haven't diagnosed you. So diagnosis is the gateway to treatment, in my opinion, and it's always best to get a proper, thorough diagnosis to make sure that you know what you're dealing with. So even as an adult, I do recommend that people get professionally diagnosed with ADHD. Okay, so moving on. As an adult, you wouldn't need to go through that full lengthy neuropsych evaluation if you aren't looking to get accommodations as a person with a legal status of being disabled. But you do want to get a diagnosis because that helps inform treatment. What can you do? Well, you're going to look for a clinical psychologist who has experience diagnosing ADHD in adults. And that person is going to give you a very detailed interview, which will probably take anywhere between 1 and 2 hours, and possibly have you fill out some questionnaires. And they're going to be trying to figure out, is it ADHD, or are there learning disabilities, or are there mood disorders? And they're going to be doing this mostly based on history. We don't need to do the neuropsych testing in adulthood for most people. Usually the diagnosis can be made just through a diagnostic interview with a qualified clinician that has experience diagnosing it. Okay, so that's how you do an ADHD evaluation for adults. Now, who can do this? As I mentioned, I think it's best to be done by a clinical psychologist. Psychiatrists can also do this, and I do adult ADHD evaluations, so if you're interested in one, feel free to contact me. The way that mine work is that you will come in for an hour and a half to 2 hours of face-to-face time, fill out some questionnaires, and the bulk of the time will be spent with me getting to know you and asking you a lot of questions about your childhood and about your current functioning. And then I will provide you with a letter. It's usually a couple pages long. It explains all of the diagnoses that I found, ADHD or otherwise, and then you'll get a list of about 12 to 15 treatment recommendations. In my feedback letters, I always include medication-based and non-medication-based treatments for ADHD, and everything that I put in there is based on scientific research, double-blind, placebo-controlled studies, because I do believe in science. So if you're interested in getting an ADHD evaluation with me, feel free to fill out a contact form on my website or give me a call. I can do this for anybody that resides in Texas, but if you're outside of Texas, my license does not allow that, but I'd be happy to try to help find somebody in your state who can help you out. Hopefully this has helped you understand a little bit about the differences in evaluating for ADHD in children and adults, and why sometimes you might get quoted an 8-hour evaluation and other people are willing to do it with an hour and a half interview. If you have questions, feel free to email me. I'm always happy to help. Take care, and I hope this has been helpful. Thanks.